Ever since I was 14, I was interested in joining the Navy, and I took the ASVAB and got a high score and got accepted into the nuclear engineering program.
I've wanted to be a doctor since I could speak, basically. The first time I was asked that question, that's my answer without probably understanding why.
My first symptom I had was on Thanksgiving Day. I was standing with my arms by my side and my right arm had given out and I wasn't able to move it or feel it.
He would tell me from time to time like his arm hurt, but not to the extreme of really what was going on. I didn't know that he was losing sensation or having chest pain.
I kept it a secret. I didn't tell my family or my recruiters.
Thoracic Outlet Syndrome is basically a problem of compression in the part of the body we call the thoracic outlet. That's the area under the collarbone between the neck and the shoulder. And there's a whole series of nerves and blood vessels that have to pass through that space that can become compressed.
When I first met Dr. Donahue, my first impression of him was that he actually cared.
Kevin was really comfortable talking with him. I think you don't get that a lot of times, and it really stood out to me.
When I meet a patient for the first time with Thoracic Outlet Syndrome, oftentimes their stories are quite long. They've frequently bounced around to a lot of different doctors. It's a very complex condition to try to sort out. And so I think listening to the details is very important.
Even though the pain was a lot to deal with, my main concern was not being able to join the military.
I try to block off an hour and a half for every new patient because it really does take that long to get all the details.
He wasn't just trying to diagnose me, he really wanted to help me join the Navy.
Understanding where a patient wants to be certainly helps ultimately guide treatment and where we try to get them.
We left that day and Kevin was really impressed and he said, geez, I'm really glad I came here.
I was optimistic because of his age and his motivation. People that are very motivated to achieve something and accomplish something, they'll overcome some pretty steep obstacles. And so from that standpoint, I was optimistic that we could help him and get him to where he wanted to be.
Every time I would ever give him a compliment or Kevin would say, geez, thank you so much, he'd say, you don't have to thank me. You do the hard work. During
medical school, I did my surgery rotation first because I was certain that would be the one thing I would never want to be. And I did it and I loved it. I absolutely loved it. And went through the rest of my rotations and nothing was as exciting to me as surgery.
Before Kevin's surgery, I did say, could you tell me roughly how long you think it'll take? As a parent, you kind of want to have that idea. And he said, look, this is normally what it takes. And he gave me an estimate and he said, but I don't rush for anyone. And I just knew that Kevin was safe.
I can never guarantee a result, but I can certainly guarantee effort, and I promise them all that I'll give them the best effort that I can.
When I had woke up from surgery, I was in the hospital for another 2 or 3 days, and every day I was there, I saw Dr. Donahue at least once.
I certainly remember feeling pretty optimistic that he was going to do well.
When he told me that I'd be able to leave and I was going to make full recovery, I was so happy. I can't really put it into words. It was my future. Dr.
Donahue's a special guy. He gave Kevin his life back.
It's a complicated problem and the stories are all difficult to sort out. There's really no easy way to do it, but it is very rewarding.
I feel better than I did before I even realized I had these symptoms, and I'm leaving for Navy boot camp on May 4th.